Did you know that a lateral pelvic tilt can be the result of the way that your jaw is positioned or the way that your jaw is moving or not moving? Not all lateral pelvic tilts are local pelvis issues. You'll feel repercussions in the local pelvis area, and you'll see a shift of the pelvis in one direction or another in that local area, but quite often it's coming from somewhere else, upstream particularly. It can also come from the feet, but this video is about upstream because it's more common. And what you'll find quite often, and this was certainly the case for me, my horrible lateral pelvic tilt, which was also an anterior pelvic tilt because it's multidimensional, was coming from my jaw and its influence on my head position and obviously my neck muscle, because really your jaw is just hangs off of your head. But muscularly speaking, and I'm going to show this, it's really part of your neck. So whenever a jaw is not positioned properly, it creates tension and unequal movement of neck musculature, and thus the neck itself, and then everything below through the thorax, the spine, and finally into the pelvis. If your lateral pelvic tilt is simply coming from a local issue, meaning it's the muscles that are surrounding the pelvis itself, then you're kind of in luck, because my last video about SI joint dysfunction would pertain to you, because the reality is you don't really have SI joint dysfunction. You have pain in the SI joints, and you don't really have a lateral pelvic tilt. You have a pelvis that is mispositioned, and that mispositioned pelvis shows up in very typical ways, in very predictable ways, because of the inherent human asymmetry that is built into us. I just want to point out that it's just not me nor just posture restoration that knows this linkage. Just look, this is from a book called Face to Face with the Face, and it's written by an osteopathic doctor and a dentist, and you'll see what he writes. An uneven bite, jaw position, or malocclusion where your teeth aren't touching properly, may lead to unbalanced muscle use, jaw muscles, throat muscles, neck muscles, with domino effects through the body. The malocclusion could, for example, result in tightness of the sternocleidomastoid muscle on one side, and I'll talk about that, leading to asymmetry of the head and neck, restriction of the bones of the cranium, so that's the temporal bone on the affected side, compression of the jugular foramen, impingement on the jugular vein, the spinal accessory nerve, which is a neck that innervates neck muscle, and the vagus nerve, causing headaches, ear pain, tinnitus. I've had it since I was 13. I don't think this is unrelated. Respiratory, cardiac, and digestive disturbances, neck and back pain, mental disorientation, and a multitude of other possible symptoms. And yes, that would include lateral pelvic tilt and anterior pelvic tilt. So here you have a picture of my cranial position. It's called a torsion. My jaw is shifted to the right, and you can see that my right canine, and still is kicked out, was discluded, was pushed out because my jaw had shifted in that direction. You'll see the left eye, my left eye is higher than my right eye. And you see that in the skeleton picture as well. So there's this counterclockwise, direction of my cranium, which created a lot of tension over on the right side of my cranium, and then create a lot of tension, obviously, through the right side of my neck and the right side of my body and the left side of my body. But it held me over into this asymmetrical pattern of right dominance that postural restoration calls the left AIC, right BC, right TMCC pattern. It just means you're stuck over on your right side, but because that jaw has shifted into an abnormal position, there's so much tension being created through the neck musculature and the neck structure itself, the neck musculature and the neck bones, and then everything down low. It can create, you can't move without restriction, and your body can break down pretty quickly because of it. And here's just a kind of before and after pic. So the before picture, obviously my lateral pelvic tilt, that was also when my jaw was shifted to the right. I was in my worst state, and I was in my early 30s. I'm 48 now, so this picture was taken a year ago compared to the picture in my worst state, which was, 14 years ago. But you'll see, obviously, my head is straighter, my jaw is straighter, my head is wider, and obviously my lateral pelvic tilt is no longer there. My lateral pelvic tilt was never a pelvis issue. I thought it was for the longest time because I didn't know about the cranium. I tried everything, stretching, strengthening. I'd stretch my hamstrings, I'd stretch my QLs, I'd roll my feet on soup cans, and it did nothing because the pelvis wasn't the issue. That's just where I got locked up because of the influence of the neck muscles on the rest of the body. It was putting me into this state of extension, this thing that arches your back and brings your head forward and tilts your pelvis forward. So what is systemic extension? So systemic extension is the problem. That's what's the systemic issue that's causing the pelvis to tilt and staying in that tilted position. But it'll generally result in body weight being held anteriorly. You'll often see hyperextended knees, an anterior pelvic tilt, a lateral pelvic tilt, increased lumbar lordosis, so an increased curve in your lower back on one or both sides, elevated chest walls, rounded shoulders, forward head neck posture, and then overactive neck, back extensors, neck muscles, back extensor muscles, hip flexors, and calves. Postural restoration teaches a lot of courses directly about these cranial relationships with the body, and this is the founder of the institute, and he's actually demonstrating, because he's over 40 years, he's seen it a lot. He's demonstrating the same exact, I think he calls this the cranial position, the cranial posture. When you're a cranially driven patient client like I was, it's the exact same. That right hip is pushed out. He's putting himself into a lateral pelvic tilt to demonstrate what he saw over 30 or 40 years. I see it also. They walk into my office. I was this person. So it's a well-known phenomenon within postural restoration. Maybe not the other part of the world, the rest of the world really, or definitely not the fitness world. But yeah, this is not a local pelvis issue. So how does it go from up here to down there? Well, you have to follow the connections. Now, this diagram is from a book on cranial sacral dynamics, meaning cranium, sacrum. So the sacrum is part of the pelvis. It's between the pelvis, between the two bones of the pelvis. So you have this kind of fulcrum, and you just have these relationships where everything has to be in balance. The moment if I move my jaw to my right, my head goes up on the left, everything underneath me has to compensate for that. Shoulders have to drop. One has to drop. One has to raise. A pelvis has to shift to one side or the other. It's a balancing act at that point. So when you have a jaw that's mispositioned, it doesn't matter how it ended up there, but once it's mispositioned and the head shifts, my center of mass has to shift, and now I have to not fall. So there's this constant rebalancing of forces, of mechanical forces, to keep you upright because you're no longer centered, and that's the issue. So the head gives you a very simple understanding of how this works out through muscular chains. If I move my jaw to my left, my body just shifted to the right. If I turn my head to the left, my body just shifted right. All right, so jaw and head movement really drives and determines what you can do with your body. If it's stuck in one position for too long, you get stuck. You literally get stuck there, and you now don't have access to both sides of your body because you're getting stuck. Your brain is learning to do everything on one side, and that's going to be the right side. So because you're not symmetrical, because your right side is your dominant side. So jaw movements drive head movements, but head movements also drive jaw movements. These relationships have to be centered. You have to be able to move your jaw in both directions. If I can do that, my head can alternate, and if my head can alternate, then my neck can alternate, because this head, when it goes down on one side and up on the other, directs the neck, and the neck directs the rest of the body. It needs to alternate on both sides so your body can move to both sides. That's really the whole point of postural restoration. People with a jaw that's positioned deviated, they're getting stuck in one position because without freedom of that jaw, the head and the neck can't rotate, and that affects everything down below. It's already been observed that the major bones in the cranium that we care about so much, which are the temporal bones, because that's the T in the TMJ, which is the jaw joint, those bones, those temporal bones, move the same exact way as the iliums, the two sides of the pelvis do, into anteriorly and out, and posteriorly and in. So the way that the cranium moves, or the way that the pelvis moves, also occurs in the cranium, and they have to be in rhythm with each other. They have to have a relationship that's functional. Otherwise, everything between them is going to get locked up. And then this diagram is just showing the relationship of the bite plane to the junction between C1 and C2, which is your top cervical vertebrae and the second one. And this area, C1, C2 area, where the head sits on top of, is what allows for proper head movement. And through that area, I think there's chiropractors that are devoted only to, I think they're really devoted to that area, but it's the most important joint because your brainstem runs through that area. All these important nerves for autonomic nervous system function, not all of them, but a lot of them go through that area one way or another. It's highly important for life to happen normally, for human life to happen normally. Normal human nervous system activity, for that to occur, this area has to be relaxed. It can't be jammed up. When the head and neck come forward, the back of the skull will start to often rotate down into a posterior rotation. It can start to impinge on nerves, like just remember the jugular foramen, the venous drainage. Everything has to occur through this area cleanly on both sides, but a body that for optimal health. But once you get locked up into one side and that alternation no longer happens, certain structures start to get tight and close up while others stay open and loose. And that becomes the problem. So when a jaw is deviated in one direction or another, for any reason, this very precarious relationship that needs to be there for optimal movement of the head and neck and thus the rest of the body can get disturbed. And once that proper relationship is disturbed, human movement and human regulation, self-regulation, can break down in a hurry. And finally, I'll just start to show some of the muscular connections so you can see it more obviously. So here's a picture of the head and the jaw and the thorax, or your upper thorax area. Just look at all the muscles that are going from your upper chest, from your collarbone, your sternum, to this bone right here, which is called the hyoid bone, and then from muscles that go from the hyoid bone up to the jaw itself, actually even to the temporal bones. You've got these SCMs. You've got obviously these very large jaw muscles, which are interconnected with these neck muscles. And remember, all these neck muscles and jaw muscles influence the chest underneath. And once a head and neck come forward, they pull the chest up as you're breathing, as you're moving, and this produces that systemic extension that goes all the way down to the pelvis. You also have these smaller neck muscles, that's C1, C2, C3, and then they run down to the upper thoracic spine area. When the head and neck come forward because of jaw, issues or mouth issues on one or both sides, now those relationships can get thrown off, and those muscles are very interconnected to your visual system with these visual neck reflexes that allow us to keep a horizontal line of sight as our head is moving. You have all the muscles of the larynx, of the laryngeal area, and your tongue. This is where speech occurs, swallowing occurs. These are really important functions that we don't think, obviously they're very important functions. We don't give it much thought, but anytime a neck and head have pushed forward, those very delicate areas that really have a delicate balance of muscle distribution to allow for normal swallowing and that allow for normal singing, normal speech patterns, normal tongue movement, can be severely compromised when a head and neck are stuck forward. And again, it creates nervous system tension, and it can show up in a lot of different types of symptoms. Here you have the big ones, the SCM, which is this big neck muscle. Then you have the masseter muscle and the temporalis muscles. Once the head and neck come forward, the SCMs pull the head and neck forward. When that happens, the jaw muscles will often tighten, and now the jaw is being driven up. This is how it happened to me. My jaw was being driven up into my upper teeth and over to the right, which displaced it. You're creating a lot of elevation of these muscles, which creates a lot of tension. And again, look at the connection of the SCM onto the chest. When you breathe, the SCMs and the scalenes are going to be pulling this chest up. And when you pull your chest up, what does it do? It arches your back. And when your back arches, what happens? Your pelvis tilts forward. And now you have a lateral pelvic tilt, and you're trying to treat the lateral pelvic tilt, and you go to a physical therapist, and they're only looking at the pelvis, or a strength and conditioning coach or a personal trainer, and they're trying to help you stretch things or strengthen things, and they're addressing the wrong issue, and it's not going to help. So if you think you're in this situation, what can you actually do about it? Well, unfortunately, if it's a true dental issue, it's generally going to need a dentist to help out with, but the dentist is not going to understand what I just talked about, most likely. What you would need to look for is a postural restoration credentialed provider, which you can find on the postural restoration website. And you want to, if you find one in your area, want to look for one that has as many courses as possible, especially courses that talk about the head and the neck cervical, if it has the word cervical or cranial or occlusion, which is teeth, in the title, those are the people that you're looking for, because they may have a dentist that they can integrate with if you need a dentist. And what happens when you need a dentist? Well, usually you start off with a mouth guard. It's a splint. It goes over the bottom teeth. It's flat on the top. You can't just buy it at a store. You can't go to any old dentist because they might not make it correctly for postural restoration purposes. I have videos about this. I have an interview with a dentist from 2 years ago. I'll link to it. I have an interview with a colleague of mine in Philadelphia, and we have an hour and a half about how this works. So it's all there on this YouTube channel. There's a lot. Does everyone who has a mandibular deviation or a missing tooth need a dentist? Well, if it's an important missing tooth, like a left molar, they're generally going to need an implant or a denture of some type. But is it always necessary to have a dentist to resolve these types of issues if the primary issue is harbored in the mouth? Not necessarily, because if you look at this picture, this woman came in to see me. She had an open bite on the left. I noticed it. Now, she didn't come with a lateral pelvic tilt, but she could have had a lateral pelvic tilt. It's just, was she stuck over on her right side? Absolutely. But the good thing was, I was able to close her bite through a postural restoration technique. Now, that postural restoration technique cannot be shown because it's just way too complicated, and you don't know the situation that you're in, and it could backfire. So all I'm saying is that it can be helped simply through finding a postural restoration credentialed individual who can work with your body, and as you do that, your jaw could come back into line more appropriately with your head, and that lateral pelvic tilt could be resolved through normal postural restoration programming. But like I said, sometimes it does take a dentist, and you need a dentist who understands these things in conjunction with what, from a total body perspective, they could make you a splint, but it doesn't mean they understand why they're making that splint, and they might not make it to the correct specifications. And that's really, it's the devil's in the details on this. Most dentists can make a splint, but it's how it's used, what it's used for, and how it's made really makes all the difference. Like I mentioned earlier, my last video about SI joint pain, it's really applicable to anybody in a lateral pelvic tilt position, because you're going to have SI joints that are mispositioned and put into a compromised state. If someone came to me with SI joint pain or a lateral pelvic tilt, I would approach it the same way, because I know they're stuck on the right side. I'm not trying to treat the SI joint pain. I'm not trying to treat the lateral pelvic tilt. I'm trying to treat the underlying pattern of asymmetry, the asymmetric position that pelvis is stuck in is the problem. That's what's creating the issues. We have to get someone off of their right side onto their left side, be able to stabilize both sides of their pelvis. They have to learn how to use their hamstrings, their glutes, their adductors. All of that is relevant. I show in that video, 4 or 5 techniques that can give you the proper context or mindset or perspective of how these issues arise. And it's not just about strengthening or stretching. That paradigm does not work very well, because it's not really the paradigm that humans work off of. You are an asymmetric human, and that asymmetry has to be taken into account. Those techniques in that video will not work, and I probably mentioned this, if it's coming from the cranium. So if the jaw is involved, most likely those techniques would not work. If it was because you have bigger fish to fry, you got to take care of what's going on up here first. However, if it's just a local pelvis issue, those are techniques that could actually help your lateral pelvic tilt, because again, the lateral pelvic tilt and the SI joint are kind of the same thing. They're describing the same situation, a position of asymmetry that has deviated the body from its normal position.